And good afternoon. It's February 20, 2024. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. Our patient here travels from Portugal, from Lisbon, Portugal. And he has two bad discs. Let's drop the table 1 inch. Good. And you can actually see on the x-ray the discs are pretty collapsed. He doesn't have really any leg symptoms, no pain down his legs, no sciatica. But he does have weakness on his exam. So we know the nerves are getting pinched. So now he's got narrowing at both right and left sides, but again, no leg symptoms and just weakness. So we're going to go on the left side, which is the side that he has the weakness on, and we're going to try to fix this disc for him. Okay, shot. And he's had back pain for how long? Shot?
10 years.
10 years. 10 years.
The worst, the last 5.
He's not very old. Shot? Still sleepy? Shot?
My friend, you okay?
AP?
Yes, he's okay.
All right.
We're going to ask you some questions.
Yeah.
Just sit tight.
So we're fixing L5-S1, the hardest disc to fix transforaminal. And L4-5 is not too bad. L5-S1 is very hard. And he's a thin man. He's got a perfect build. There's no fat on his body. But the iliac crest, which is what blocks the access, runs through here. And I have to be a little more medial to get around it and get through the foramen. So we're doing that right now. Okay? All right. Are you comfortable?
How are you doing? You doing all right? How are you, my friend? You okay?
Lay still.
He's okay.
Any pain?
Any pain right now? No.
Shot. All right. Yes? In your back? Shot.
Where's your pain, in your back or your leg? Where? He's having back pain at the moment.
Don't move.
No?
Shot. We're right at the back of that painful disc. And we're in. Very nice. All right. Now, we've already numbed things up, so we're going to go ahead and do a 7mm incision for the scope. We're going to place needle number 2 at L4-5. And he's doing great. Everything's good. Everything is going well for you. All right, perfect. And, you know, his spine is really posterior, which I like. It makes it easier to get to. And, yeah, he's anatomically, he's perfect for the surgery. I mean, I haven't checked everything out anatomically, just his back. All right, AP. All right. Now, he's been on some type of a blood thinning medicine or herb because his blood is a little thin. And I don't mean like lateral. I just mean platelet function. You can tell the platelets are not forming the platelet plug. Normally, this would bleed for about 30 seconds and then stop. But he's bleeding longer because he's probably taken some type of an herbal for his pain. Could be fish oil, could be ginkgo biloba, could be something else, Red Bulls, who knows. All right, now he's had back pain for 10 years, we said?
Yes.
Folks, lower back pain, 10 years. He's from Lisbon, Portugal. You heard me right. He flew here for the surgery. So he came here because he didn't want fusion, which is all he was offered. You can see his MRI at the bottom corner of your screen. In Portugal, that's all they're doing, old-fashioned fusions. And obviously those are dangerous surgeries. Are you comfortable? And when I asked him, where is your back pain? He said it's right in through here. And he's got two discs that are damaged, L5-S1, L4-5. Any pain?
Have
No?
any pain right now? No.
All right, lay still. How bad is that? How much pain on a scale of 1 to 10?
Give us a number.
10 is the
You
worst.
said 1,000.
1,000. All right, that's our first 1,000 ever. And is that where you get your pain? Yeah. So you hear that? So he has 1,000 over 10, and that's concordant. All right, is it better now? It's better?
A little bit better now.
All right. Yeah. How bad is that on a scale of 1 to 10? Huh? I think he said 999,000.
You did say a lot of times.
All right, 999,000 over 10. You get to go to sleep now, my friend. Okay? So we have found the pain, his pain source. That pain will be gone when you wake up. Finish. No mas. I know he doesn't speak Spanish, but that's the closest to Portuguese I can get. Right? Terrible, isn't it? I got a lot of Brazilian friends. They speak Portuguese. To me, it's too hard to understand. But fortunately, they also speak Spanish. Right, Luis? Most people that are Brazilian speak Spanish. Huh? No, they speak Portuguese. But I said that's the closest because I have so many friends that are Brazilian that speak Spanish. So, but he speaks fluent English. So, yeah. All right, let me know when I can get started. He's sleeping, hopefully. Yeah? We're going to get started. Now, Henry, let's show the audience, why do these herniated discs cause so much back pain? What's the reason? What's the mechanism? What's the reason behind it? All right, so now you know why these discs cause so much pain. Now I'm going to show you how we fix them. Go ahead. All right, so now you can see, there we go. You can see this, we need some Flomax. You can see for the scope, right? You can see how we fix these painful discs. We go inside, we find the tear, which is right in front of you there. You guys see that? The
Yes, we
tear?
do.
And we use a laser. And that's the only way in the world to fix this, okay? You could also do a fusion with cages, remove the disc, put in screws and rods. But why would you ever want a fusion done if you could have this, okay? You wouldn't. That's the short and long.
Please. Thank you.
Now what you're seeing there, that glass thing, the tube, or fiber we call it, it's not really a tube, it's a fiber. It's a conduit for laser energy. It's taking laser energy generated at a machine that is at the patient's feet, and it transmits that energy from the machine through this fiber, which is about, how long, 6 feet, 8 feet?
Around 6 feet.
6 feet long.
Yeah.
And it takes it from one end of the fiber, and where it's generated by this laser machine. These machines are over $100,000 new. And it brings that energy from the machine to the tip of the laser fiber. And you guys can see the tip of the laser fiber. It's right in front of you. And it's wrapped up in a blue plastic just to protect the actual fiber, because the fiber is made from glass. It's made from glass. It's a fiber optic, glass fiber optic cable, fiber optic fiber. Anyway, you know what I'm saying. So basically the laser energy is discharged from that surface, the tip. And in case you're wondering, the tip of that laser fiber where the energy is discharged is 1 millimeter diameter, 1 millimeter diameter. So that gives you an idea of the scale of what you're seeing here. You are seeing very, very small things. Look at the tear. Oh, wow, it's perfect. You guys could see it so well. White is annulus. White is annulus. Right in the middle is the tear, and the blue stuff is the herniation. What do you think that is? That smudge? All right, if you have questions, feel free to type them up and I will answer them. They're a little smudgy. You think that's on the tip of the lens, or you think that's on the camera? All right, get me a Raytech. Let's get ready to clean it. You ready? Wipey, wipey. I hope the lenses aren't knocked out. Who's been,
Mainly Destiny.
huh?
Mainly Destiny.
Yeah, I know, but you got to look at the incidence of
Yeah,
lens problems. Right now, the answer is no, we're not. And it's 99.999% no. And apparently, she's flipping out. It's her own fault. Any questions, Henry?
Literally, as you asked that, we just got either this is a question or comment from Tammy on Facebook.
Hi, Tammy on Facebook. I'm Dr. Deuk Majin. Welcome to our live stream. Go ahead.
They just, it is a question they asked. While repairing the disc bulge/tear, are you able to address severe bilateral neuroforaminal narrowing, or is that only able to be addressed via foraminotomy?
All right, Tammy. Thanks for asking. Great question. So, Tammy, what's causing the foraminal stenosis is the herniation. And by removing the herniation, we are treating the stenosis. A foraminotomy does not treat the cause of the stenosis. Foraminotomy is a horrible surgery because it removes normal bone and ligament from your spine. It's bone and ligament that you need to hold your spine together. but it's a surgery that's been done for 100 years, and many doctors still do it. Even though they should not do it, they should be doing this surgery. So this is the future of spine surgery. You're watching it today here at Deuk Spine Institute, where it was pioneered. Okay? Now, we're not the first to do endoscopic surgery on the spine. We're not the first to open up the neuroforamen. Okay, that's been done by others before me. But we're the first to use the laser to clean the tear where the herniation came out of, so that the disc will heal. And your symptoms will go away. So yes, this surgery treats the stenosis, the narrowing, and it's the best treatment for the narrowing. There is nothing better. We've got probably 5 minutes on this disc. Yeah, Luis. You're monitoring, right? Because if we have a high incidence of lens dislocation happening, it's the processing that's causing it. You understand?
I understand.
And you got to do something about it. Unless you want me to.
I'll take care of that.
Yeah. But first verify that's the issue. And then once you've confirmed it, you have to do a root cause analysis. Find out the source. Okay, at this point, we're removing, here, take this. Let me have the, camera looks good. Any more questions from our audience?
No current questions. It's just a comment from Tammy just saying thank you.
You're welcome. Yeah. Yeah, there's still something there, Luis.
At the bottom, I can tell.
Huh?
See at the bottom.
Right? And it's not the camera or the proximal part. And that you clean the distal part, right?
Yeah.
Why don't you get another scope? I mean, there's no reason for this to happen. I don't know the history on this scope, but you should look at it. You know what I mean?
Yeah.
How many of these do we have?
We have like 6.
Oh, what?
9. And this one 9.
Yeah.
There's cervical is one over
Yeah, I was going to say. Why don't you get some more?
there.
Hmm?
I need
If you can get used ones, that would be great.
Yeah.
All right, any questions, Henry?
At this moment, no current questions.
Again, what we're seeing here is tremendous amount of herniated disc being scarred down to the annular tear. Same thing we see in every single patient. You know why I'm asking? Because I don't remember seeing this before, right? So it happened since we used it. So it has to happen during processing. You understand what I'm saying? Yeah. I thought Jordan was doing the processing. Huh? No?
I'll tell you.
No, it's your call. You run the show, so you have to decide. Unless you want me to decide for you. But you should be the one deciding. You're the boss of this area, right? But you got to be able to trust the people you're working with to do their job right. And if you don't, you got to train them, and if you don't, they still don't do it right, you got to axe them. Okay? Right, Henry?
Of course.
Do we have the new scope? All right, any questions, Henry?
At this moment, no current questions.
So one of the nice things about many of our patients, they actually watch the surgery here before they come and get it done. And some of our patients that come here are actually quite knowledgeable about the procedure, how it's done, and what things should look like during surgery, as a matter of fact. Let me know when you have it.
I'm ready.
All right. Give me a grabber and let's go ahead and change out the scope. Give me a second. No questions?
No current questions, no.
We're going to change our scope out, folks. So if you want to watch, you can. Just takes a minute. The scope on. Not even a minute. We're back in business. Scope on. Hold on. Let me just focus. You guys see the fat down there? It's a little bit not as bright. I don't know. Luis, any thoughts? Think that's a bulb issue, or because it was fine with the other scope? Is the attachment okay?
Yeah, amazing. Looks good.
Laser? It's just not as bright. This fiber optic light source is the same.
Increase. One more.
It's interesting. But the scope is not allowing as much light to go through. You know what I mean?
So that's probably a license.
Why am I getting a wet foot? God damn it. No, if the other scope was fine, and this one is not, it's got to be the scope.
The light source. Not the light laser fire, the light source on the scope.
Well, yeah, wherever transmits light through the scope. Can you verify that?
I can verify that, of course.
The way you do that is you got to try connecting it to one scope, getting it nice and bright, and then connect it to this scope and see if it's as equally bright.
Correct.
And if it's not, that means there's a problem with the transmission of the light through the scope from here to there.
Correct.
The fibers may be broken.
I can tell right away on if it's stained or it's burned from the use
Oh,
of the
right,
light
right.
source as well.
All right. We're just doing a little troubleshooting here while we're operating. All right. Almost done. We got about 30 seconds left on this disc. Sorry, Tasha, but herbal remedies don't work. Everybody tries them and then they come and have this surgery. Unfortunately, there's lots of spammers in, what is it, Facebook?
Facebook, yeah.
Yeah. Facebook does very little to block the spammers. All right. All done. We got one more to go. So we're going to suck this tube dry. You can see the fat cells. Going to put some
Go on, please. Thank you.
not antibiotic, but some betadine. Hmm? One down, one more to go. Thanks, Luis. You guys see this incision here, Henry?
Yes, we do.
Surgery is done with a 1/4-inch incision. Seven millimeters. All right. Here we go. Shot. I'm going to take this needle out, leave the guide wire. Shot. Thanks, Jordan. We're going to slide our dilator down. This dilator is going to gently spread open the soft tissues, kind of like putting a pin in a coat. Or if you've ever gone to prom and you've had a flower pinned on your lapel, a boutonniere, that needle, the little pin, it goes through your tux or suit. It doesn't damage your fibers. It doesn't tear your fibers. It spreads them. And that's what we're doing. We're spreading. This is a spreading thing. Now, other types of surgery, microdiscectomy, laminectomy, artificial disc, fusion, they all damage. We're not damaging. We're spreading. The reason we don't damage is it's such a small incision we're able to spread. All right, come on out. Go ahead. Shot. Perfect. All right, we're in. We've lost maybe 1 cc of blood, and this is basically bloodless surgery. Bloodless, scar tissue-less, metal-less, no metal implants, no post-operative pain. These patients don't take pain meds. They take Tylenol and muscle relaxer, and that's it. All right, so here we are. We're inside L4-S1, cleaning out the disc. Whenever you get a disc with lots of scar tissue from chronic inflammation, that's when the laser does a lot of work and very little is seen. Come on. In other words, you got to hit it hard with the laser over and over again because it's so scarred. And scar tissue is so thick, it just takes a lot of energy to disrupt it and break it up. There's the reason why he's having pain. You guys see the red? That's his pain source right there. So, right in where the herniation is. So now we've gotten rid of his pain source. So his back pain literally is gone. That thing was a millimeter. It's as wide as the laser fiber, a millimeter wide. Gotta find the pain source or you don't fix the pain. 1 millimeter. And that's why, folks, these surgeries, they don't work by taking disc material out. They work by getting rid of the herniation. You know, we're trying to figure out why it's not brighter. Thanks. I wouldn't mind if it's a little brighter. Thank you. We can make it a little brighter. Yeah, that's good. Thank you. We got 5 minutes, doctor. Uh-huh. There it is, the last of the L4-S1. Yeah, we're just about done. We're in the most painful part of the disc right here, the tear. All right, any questions, Henry?
No current questions.
Can you verify? Yeah. Why? You want me to go off? Let's just go ahead and run our video on how the Deuk laser disc repair fixes discogenic back pain. Henry, need a response?
Yes. Apologies.
Let's run the video on how this surgery fixes back pain.
Copy that.
All right, welcome back. Once again, you see how the surgery works. Who's having trouble hearing? Do you guys just...
I'll call right now.
Since you can't fucking do it,
I can't do it, but she couldn't hear me, so I forgot the number because I have other things I'm thinking about right now.
tough shit. This is the most important thing to think about. Go ahead and mute me. All right. Sorry about that. Everything is going perfectly well for this patient. And we're pretty much done. I've just got to finish this last little bit right here. And our Portuguese patient gets to go back to Portugal without back pain. Grab her. All right, all finished.
Sitting on this.
All right, Henry, you can end the broadcast.
Copy that.